Welcome to That Medic Network's webinar series. My name is Lahari Ramini, and I am the U.S. Leadership host. With me today, I have Tricia Pendergrast, a second-year medical student at Northwestern University Feinberg School of Medicine. So, Tricia, to begin, I want to first start with some questions about your academic background. What drove you to get into medicine?
Sure. So I actually also attended Northwestern. While I was there, I was interested in a lot of things. I think I always had my eye on something in the healthcare field. My dad, before he retired, was a paramedic. So I grew up actually as he did a lot of like pre-hospital retrieval work and worked on like a helicopter-based service, which was really cool growing up with that. So when I got to Northwestern, I started on the pre-med track and then really oscillated between, do I want to go into medicine? Do I want to get a PhD in psychology? Do I want to be a physical therapist? Do I want to be an athletic trainer? So I did that for like 3.5 years. I couldn't decide. And I think what I finally settled on in terms of I had to choose something. I really wanted to do something where I would be on track to be in leadership positions. So the idea of being able to be, the leader of the healthcare team, potentially one day holding a position like a dean of something or running a department at that time was something that really appealed to me. So that is sort of why I went into medicine. I had only knocked out like 50% of my pre-health requirements at that point, however, because I couldn't choose over the 4 years. So I did have to do them over the next couple years while I was working. So after I graduated, I went to work in a research lab and then did classes at night and studied for the MCAT.
Mm-hmm. So could you describe like your experience at Northwestern University Feinberg School of Medicine in the past 2 years, what you've done up to now being a second-year student?
Sure. So before COVID happened, it was a very standard medical school experience. I would go to class. I did all the med school things. We had anatomy lab. We had some clinical experience. Really, when coronavirus happened, I was in the spring of my first year. So I'd been in school for about 8 months at that point. And we transitioned to being remote. So a lot of the preclinical work that you do before you actually go onto the wards can be done remotely, but it's very strange having your entire curriculum moved offline in the middle of a module. We were in our renal module, so we were studying kidneys. And at that time, I think a lot of us sort of felt this desire to help with the pandemic. It's sort of a strange position to be in, right? Because you've already, joined the medical profession. They tell us, you put on the white coat, you're part of the medical profession, but we're not able to even be in clinical spaces and even sort of practice medicine like we can third and fourth year. So there was this feeling of sort of helplessness, but also a desire to help. And so that was where a lot of these efforts I got involved in came from. So the Northwestern students put together this sort of multifaceted COVID response that included personal protective equipment donations. There was an effort that we organized to contact seniors. So one of the other students that I was working with really spearheaded that part to contact seniors and basically provide a connection. And so we had medical students calling them, which was really great. We also had a physician support network. So we had a way for physicians at Northwestern to be like, hey, I need someone to walk my dog or deliver groceries or do things like that because people were working crazy hours. So there was all of these different components. And then that sort of continued and is still continuing. All these boxes behind me are personal protective equipment. So it's still going on now. And my entire second year has been more or less remote with some key exceptions. So I still do clinical skills in person because that's really hard to teach online. And we still had some anatomy work in the lab. But aside from that, everything has been remote. So I've just been here at my desk learning medicine, which is kind
Yeah.
of wild.
Wow, that's especially because medicine, I feel like, is a very practical profession in terms of like training and things like that. So I'm sure that was probably difficult and definitely different for you. So you said that you mentioned that you have PPE behind you. So that's crazy. Could you tell me a little bit about the movement that was started with the Chicago area schools?
Yeah, I mean, I think this is a really cool story because something that we are really not so great at in medicine is collaborating with other institutions,
Mhm,
um, even if they're like 10 minutes away from us. I mean, where I live right now, I'm about as close to Northwestern as I am to like UIC and Rush.
mhm,
And then, U Chicago's a few minutes down the road, and Rosalind Franklin's a few minutes down the road the other way. So, the personal protective equipment work really grew out of um, us figuring out that there were students at other schools in Chicago doing very similar work, and we all were sort of taking the same approach. So, the first sort of approach we had to personal protective equipment donations was to reclaim it from the community, because there were people who had, random boxes of gloves or N95s. Like a lot of people who had done, home remodeling would have like a spare box, right?
mhm,
Or we would be calling businesses who we knew were using these items and asking them to just give them to us so we can repurpose them and bring them to healthcare workers. And
mhm,
so when we realized that there was a bunch of students all doing the same thing, we were like, there is no way this is going to be productive if we're all trying to do the same work in the same city if we don't pool our resources and work together.
mhm,
So, and that was just sort of an understanding that everybody had. We were, it was a little awkward and strange at first because we were working with people that we had never met before in our lives, trying to do something that none of us had any training doing.
mhm,
Um, but we made it work. And so there was, several weeks in March of last year where there was a group of us, students from Northwestern, Loyola, Rush, Rosalind Franklin, UIC, spending hours on Zoom with each other. We'd never met, and designing what became essentially a very robust strategy for contacting, every business in the city that we thought might have personal protective equipment, as well as beginning to fundraise to purchase our own and building relationships with other groups across the country doing similar work.
mhm.
So, and it happened really fast, which was really cool. I mean, there was a lot of momentum, there was a lot of energy. And that has sort of morphed over time to be a different, these many different ways that we've gone about providing PPE to people. So while we first reclaimed the PPE from the community, we then began fundraising and purchasing our own. We were really good at the sort of last leg logistics. So some of these larger organizations that had the financial resources didn't necessarily know what was going on the ground, but they wanted to help. And we were able to prove that we could get things where they needed to go, and distribute on behalf of these larger organizations, and also fundraising. So we were able to write grants and crowdfund and put together, what amounts to now, I think, about $60,000 of fundraised monies.
Mhm.
And that's on top of people, supporting our Amazon wish list. So they'll buy hand sanitizer and then send it. So very multifaceted approach. So now there's still a need for PPE. I mean, we've actually seen it ramp up in the last couple of weeks because people are getting very nervous about this new strain with good reason. Um, and it's still a group effort. So our leadership is still from multiple schools in Chicago. We have a group of drivers who are responsible for bringing our precious goods to their destinations. We have people making gowns, we have people making masks. So it's really awesome all the different ways people are sort of pitching in. And then people who are, they don't have a car, but maybe they have a couple bucks to spare, will donate to our crowd fund. They'll spread the message on social media. So it's really great. It's a very dynamic organization, and I'm very proud of what we've accomplished.
That's truly amazing what you guys are doing, especially at the start of the global pandemic, where there was very much a necessity to have to have that momentum to come together. So could you describe your own role in like what did the day-to-day look like as like you were meeting with a group, and how did you put things together? Was it very much just like hustling it and asking people, or how was that?
Yeah, that's a good question. And I mean, the answer is a little different based on what time frame you're really thinking about. So initially, initially it was just a scramble. I feel like the the first couple weeks were literally us. So our work spread through basically word of mouth
Yeah.
through the Chicago hospitals. And so we would be getting text messages from ICU physicians and emergency medicine nurses, because there's a couple people, there's one person from each school, right? And they know someone who knows someone who knows someone, or like their attending's colleague is this, and they hear that we're doing this work and they say, hey, can I pass off your phone number? So there was a lot of like driving masks to people's houses before they went in to work, or we would drive up to the parking lot outside of the emergency department and someone would come out and like clandestinely sneak the PPE in. Because what we were facing a lot at the beginning was we would get text messages or calls from people who were working in the trenches, and they would be like, well, my entire team has been using the same N95 for the last week and a half. They won't give us another one. And then we would call like the donation center. A lot of the hospitals in Chicago set up like official mechanisms by which to donate. And they're like, oh no, we're fine. We have plenty of PPE, because part of it is like a public relations issue. So it was a lot of literally sneaking things into places, which was very disheartening as someone who's going to eventually work in healthcare, um, and frustrating. But we did it anyways, right? Because it had to be done. And we would, there was a group of us who were sort of the core PPE donation drivers before we recruited our group of drivers that help us out now. And we would all, spend the morning driving throughout Chicago and picking up, 5 masks here and 20
Mhm.
masks there and a box of gloves and some face shields. And then we would like meet in a Target parking lot and swap, so everyone had about the right amount. So, I would show up with like 10 masks and 50 face shields, but no gloves. And then like, Ashley would show up with a bunch of gloves, and then like her and I would swap, and then we would go to 2 separate places and provide a donation. So it was a lot of that initially. And there was a couple times where we were doing that at like 3 in the morning, because it's a pandemic, right? So if someone goes an entire shift without appropriate PPE, the effects of that on them and their family could be devastating.
Mhm.
Now it's a little bit less dramatic.
Mhm.
We have an amazing group of people who do our community outreach. So our belief from the beginning was that we need to be proactive about contacting vulnerable facilities in our community. So initially that meant, the safety net hospitals, and then it was nursing homes, and then it was homeless shelters. Um, so we proactively do that outreach. And then we as a group decide where we want the donations to go. We'll vote. We'll say, hey, this is fair. This is not fair. And then we have our wonderful driver coordinators who will get the PPE where it needs to go. So it's a little bit more compartmentalized now.
Mhm.
I do the inventory, as you can see, and a little bit of just general organizational guidance. But it's a lot of like really great people who are doing specific aspects of the organization's work, as opposed to all of us sort of scrambling in the beginning.
Yeah, of course. I definitely think it obviously took some time for you guys to get where you are now. But even just, um, I think it's, I think it's really amazing that you got to put that together and scramble together and still were able to continue with your mission and get people what they needed during this time. You mentioned that you had to do like a little bit of sneaking around and the difficulties, like the issues in public relations and medicine and all of that. Could you elaborate on that a little bit?
Yeah, I mean, that was definitely the most frustrating part. Well, no, that's not true. The most frustrating part was that we were in this position to begin with at all.
Yeah.
There was plenty of leeway and time to prepare, and we didn't. So that was the most frustrating part.
Yeah.
Um, yeah, so there was this inability for hospitals to admit that they needed help in the beginning, um, which was really maddening, right? Because their people were in danger. And for the sake of the brand, for the sake of public relations, facilities were unwilling to accept help.
Mhm.
And seeing that as a future physician, it was just so frustrating. We talk a lot about in medicine, wellness and, taking care of yourself and, oh, like, resilience, right? That's another one of those words that gets thrown around. And maybe the problem is we're asking people to be resilient when they're in what is essentially abusive relationships with facilities that are more interested in protecting their name and their reputation than their people. That is a problem.
Mhm.
um, that is a big problem. And so that's why we were forced into the position of just physically giving masks to, program directors so they could protect their residency classes. Again, none of that should have ever happened, but the fact that we had to do it behind the backs of a lot of facilities felt really gross.
Yeah, disheartening, that at least like the general public isn't aware that there's the hospitals kind of run almost like a business rather than being there for people, which is their job. So seeing that firsthand for you must be horrible.
Yeah, I saw a um, very, very well timed video this morning, actually, of a CNA
Mhm.
who was sort of summarizing the healthcare system. I think it was a TikTok actually, but she basically said, like, we as healthcare professionals are asked to sacrifice both our physical and mental health. And this is not even in a pandemic. This is just generally. But and I've been saying from the beginning of the coronavirus pandemic, there were no new problems that were created by COVID. It only served to amplify our existing issues. And that's like from a healthcare perspective, but also like a societal perspective, a complete, we underfund our public healthcare system. This is what happens. um, we're asked to sacrifice our mental and physical health for the sake of a corporation's profit. That's the bottom line in this country of healthcare in the United States, which is really sad, especially because you have international listeners and viewers, right? That's not the same everywhere. Um, that is really, it's almost like a nauseating thought to sit with, right?
Yeah, it's a big problem here that doesn't get much awareness either, in terms of like the general public even knowing that. I think you have to be in a position to be able to really see firsthand the effects that.
So nursing homes are the location of about half of the coronavirus deaths in the
Mhm.
city of Chicago. Um, they are underfunded to begin with. And many of them are run by large organizations that are in it for profit. Again, here we're back to like the theme of the last point I made. Um, so again, there's a situation where the company will say everyone has okay PPE, and then we'll call and we'll talk to like the nursing manager or the person who's in charge of their supplies, and they'll be like, oh my god, no, they only give us like 50 N95s a month. Like, please, can you help us? Right? So there's this disconnect.
Yeah.
The other thing that has been really obvious doing this work to many people, but to us doing this work, is that um, like labor rights and health, health insurance and leave from work, um, that those are all major public health issues. And so in nursing homes, they are predominantly staffed by people who are underemployed. So they're people working part-time. They don't have health insurance. They don't have sick leave. Statistically, they're more likely to be women of color who have never graduated from college, disproportionately on federal assistance, disproportionately um, not US citizens.
Yeah.
And so it's just like layers and layers and layers of just like a societal burden on these groups, right? And so then we have these people who are working in this very dangerous situation where COVID is just running rampant through the facility. And then these are the same demographics of people who are more likely to live in multi-generational homes, who go to zip codes with higher community spread. So there's just this amplification of what we so lovingly refer to in medicine as like social determinants of health, but that's really a code for like racism most of the time. Just amplification of that, right? And so like you can take all of that and at least mitigate some of the effects, at least in that person's home, by making sure they all have adequate personal protective equipment. Like we can't even begin to solve most of those problems, but if we can help people feel safe at work, go to nursing homes and feel safe at work, that is huge. So I mean, it's that theme again and again and again that we keep seeing, and why, you know, despite all of us being back in school now, we continue to do this work. Because the other part is, if we don't do this work, it's been a year. So if someone was going to come help, they would have some sort of official channel. You know, the PPE budget for homeless shelters in Chicago was $0 for this year. So if someone was going to pay money to do something official to make things happen, it would have happened by now. And so we kind of feel like we're, you know, the only one that cares sometimes, which is really, that's not great.
No, it's not at all. And but what you guys are doing is really inspirational, but it is also like the bare necessity for people. And the fact that, you know, there is no government facility that takes care of this and takes care of these things is really, it's horrible. But the work you guys are doing is truly amazing. Thank you so much. Like on behalf of like the entire community, that's amazing. So I do want to ask you a little bit about your own interests. So your experiences with this personal protective equipment organization, and how is that translating into your future of some type of role in leadership, healthcare, or anything like that?
Yeah, that's a really good question. I'm not sure how exactly it will inform my future career. Um, I like doing community-based work. I think, at least for me, the pandemic has highlighted how much you can get done outside of the traditional confines of working in healthcare or in an academic institution. We've had the opportunity to partner with or just provide donations to just so many community organizations, mutual aid groups, people out in the community who are really doing amazing work. And I think sometimes us healthcare people sort of get caught up in trying to do things from the perspective of like working within your academic institution. I think for my career, something one of my mentors always says is like doing things from a perspective of solidarity and not charity. So I think like that is really going to stick with me in terms of how do we as people with privilege, whether that's, you know, racial, ethnic, or I mean being a physician is a privilege certainly, how do we support our communities? I think that answer is not always going to be, oh, start an initiative at my academic institution. Sometimes that's the answer, but I think there's so much that can be done outside of those traditional boundaries. That is something that I'm going to sort of be like looking for as moving forward in my career. One of my favorite mentors, literally, she's a family medicine physician at UIC. She started a foundation and made a food pantry.
Oh, wow. Okay.
Her with her husband, who's also, I believe, a family medicine physician. She's right, like she saw a need and she filled it, and she was like, I can do more by going into the community. I have identified a need, and she made it happen. Like that to me is leadership, right? I kind of want to do something like that.
Yeah.
I think another thing that this has taught me, maybe it's just a thing that's developed over this year, but I really do like teaching. I think I was actually talking to someone about this the other day, and like if I wasn't a physician, I would probably want to be a teacher. So I think the further I've gotten along, I've been more interested in like medical education. So maybe looking into my career, I want to do something that's very heavy with teaching, being a clinician educator, um, getting involved with curricular development, maybe one day getting some formal training in education, because it's so enjoyable. And throughout this pandemic, there's been a lot of these student groups who are doing this work, teaching each other the ropes, because we're all, initially we were all just making it up as we go. Um, but I've loved that aspect of it. Like that really sort of softened the blow of a really challenging situation, was that experience interacting with other people. So I think those two components.
My name is Dr. Siddhar Mao. I am a former HRA Scholar, FY2 doctor in West Yorkshire. The HLA is a great experience. It's a unique experience, and it's a personal and engaging mentorship process which gives you a pragmatic and realistic approach to true leadership, which we can take on to all aspects of our career.
So what kind of advice do you have for students going into medicine, but also wanting to make a difference in the community in any way that they can?
So I think your choice of medical school is really important if you are lucky enough to have one. Um, there really isn't like a bad choice for medical school. Medical school is medical school is medical school. Like if you get in somewhere, it's gonna be fine. But I remember when I was interviewing, the opportunities for community engagement were very different. And I mean like the opportunity to do it and also the type. So like Northwestern, we're in Chicago. So there's a lot of work to be done in Chicago. But when I was interviewing at George Washington, they were very focused on public health, and they had a lot of opportunities to engage with elected officials because they're in DC, right?
Yeah.
When I was interviewing at Columbia, in New York City, there was just so much going on in New York City. I felt almost overwhelmed. So I was like, this is too much. But then it was like and then like another example was somewhere in Michigan. So like there's so many different places that take their own unique approach to community engagement. And so figuring out where you legitimately see yourself is huge. Like I'm not really into the whole policy, public health
Yeah.
thing. But there's plenty of people who are. And so that's the right place for them. And so sometimes it's not about like, ooh, like which one is the best school that accepted me. Actually, it shouldn't really be about that. It's where am I going to be able to like really flourish, and where am I going to be able to get involved in things that I care about? Because if you like, medical school is exhausting, and if you try to force yourself to do things that you don't really care about, it is terrible. It's soul crushing.
Right.
So you have to find places that you're going to be genuinely excited to get involved.
How can the audience get involved with helping out with GetMePPE?
So the easiest way to find out like more about how to get involved would be to go to getmeppeshy.org. But that has all the information that you really need to know. It has links to our social media. It has a little page explaining donations. We'll really take all the help we can get. If you're someone in the area with a car, we would love to have you drive our donations. If you want to make gowns and you have some time on your hands, we would love that. If you want to send our Amazon wish list to maybe your friends and family, or post it on your Facebook page, once every couple weeks, and encourage people to just, buy some hand sanitizer. That all of those are great options. The other thing that we're really clear about is we really don't want people to remove resources from their home communities. So if you're listening to this and you're in New York, please do not send us cloth masks, or if you're in Texas, don't send me hand sanitizer. Find out where you can make a difference in your community. So the facilities that are really hurting right now, for the most part, are going to be nursing homes and homeless shelters. And one thing that I really like to encourage people to do is when they make purchases for their family, so when they, stock up on hand sanitizer, or, buy themselves a box of face masks, buy one for, the closest shelters to you. Buy a gallon of hand sanitizer for the nursing home, close to your school, right?
Yeah.
I think people sometimes underestimate, because we did a little bit at the beginning, and this is a lesson that we've learned, this cumulative impact of a lot of small things. So, 5N95s, people would email us and they would say, I don't really know if these are going to help, but you can have them. We never said no to any of those offers. And what we would get is a bunch of people emailing us saying, well, I don't really know how much this will help, but you can have them. And then from that, we would put together a donation that was enough to cover an entire team. So the cumulative impact of a bunch of people choosing to do the right thing is so, so powerful. And I would encourage everyone not to write that off when they're thinking about how they can help their community.
Okay, thank you so much for sitting with us today, talking about your experiences and everything. I'm Lahari Ramini. This has been Tricia Pendergrast, and this is That Medic Network. Make sure to like, subscribe, and leave a comment of who you would like to see on the show next.
Can I start?
Okay, ready? Yeah. 3, 2.
So what do we say for the HLA? Why we took part?
Don't move chin.
It's all right, I'm just going to stop.
Just when you ended.
Don't look away.
Yeah,
That is not going anywhere.
Just another day at the office.
Hi, I'm no.
Most important thing is what I've learned from the HLA and adapting it and moving forward and making sure, I make use of it. The reason why I don't know what to say now. If I make a mistake, can I just take a pause and then start again?
Yeah, I'm ready.
Don't really know what to say. Don't record this.
I've really enjoyed it. I've learned so much, and I've really benefited from. Oh God, what have I benefited from? Oh.
Okay.
Is that it's been a fantastic. Oh no, I've lost it.
Can you give me a countdown?
I don't know how much to gesticulate. How much? It's quite a mellow person. I don't know.
I'm ready.
Thank you.
Okay, I think I'll chop and add some things.
We're looking forward to seeing you. Bye-bye.